Good morning, good evening, good afternoon. My name is Nick Crofts. I'm Executive Director of the Global Law Enforcement and Public Health Association. Increasingly, it is being recognised that complex issues that have criminological, law enforcement, public health and community welfare implications are not dealt with well by single sectors acting alone. The Global Law Enforcement and Public Health Association is working to bring the sectors together: law enforcement personnel, criminal justice personnel, people working across the whole range of public health issues, along with government and affected communities. Around the world, societies are increasingly exploring alternative approaches to those complex issues rather than simply relying on criminalisation and leaving these issues to be dealt with and handled by police, when they can be better handled by public health or by partnerships. Our project, Envisaging the Future of Public Health and Policing, is a global project that's working to identify and examine these alternative approaches and initiatives, to learn from them and to see what works. We have reports here in this session from our research colleagues in 5 global regions: in Latin America, in Africa, in the United Kingdom, Western Europe, in Eastern Europe and Central Asia, and in Asia and the Pacific. We look forward to hearing your responses to our findings of what exploration is being done in these different regions of issues that bedevil us all. Thank you.
Good day, everybody. My name is Munya Katumba, and today I'm representing the Center for Law Enforcement for Public Health on a project where we investigated case studies on law enforcement and public health collaborations and partnerships, and I represented Africa. Also working with the Center on issues around building a network for law enforcement and public health in Africa. Also consult for 2 organizations. That is the first one, AIDS Funds, based in Amsterdam, on training police officers in Southern Africa, as well as also working with Southern Africa Regional Police Coordination Organization that is based in Harare, that covers the Southern Africa region. With COC Netherlands, I'm working on issues around SOGI, that's sexual orientation, gender identity and expression, and human rights with policing in Africa. My presentation today will cover the situation regarding law enforcement and public health, collaborations and partnerships in Africa, but mainly with an emphasis on Southern and East Africa. I'll also cover who drives these collaborations and partnerships, as well as also, do they work together well, or are there any issues or problems, and what are those problems and challenges? I'll also give examples of programs that are working to build better partnerships and collaborations as it relates to law enforcement and public health. The situation regarding collaborations is some of the examples are collaborations and partnerships when responding to epidemic and pandemics, for example, HIV and AIDS, STIs, TB, malaria, and we've also seen a good number of collaborations as it relates to COVID-19. Also responding to gender-based violence as it relates to agenda setting and policy reviews within countries. We've also seen some very good partnerships as it relates to socioeconomic problems and challenges when government, parastatals, private sector, and NGOs come together. There have also been some of the situations of collaboration that I'll cover that cover counter-insurgents or responses to terrorism when it happens within civil spaces, especially when law enforcement is addressing issues around rape, disease, death, for example. Are these situations and partnerships working well? We have seen a few of them, especially those with a long history experience of working together. Also those who have common goals towards local, national, and global health outcomes. We've also seen that there are those that do not work well, especially due to antagonistic situations. Civil society organizations, CSOs, sometimes puts blame on law enforcement. Law enforcement sometimes perceive civil society organizations as enemy of the state. And sometimes when law enforcement are trying to address issues that relates to criminalization, they're always there to say, we are there to arrest criminals. And there are issues around, let's say, if projects and programs are being implemented and still the status quo or things remain the same. We've seen some antagonism there. Who drives these collaborations? There's quite a number of partners that drives them. The first one is the government and law enforcement themselves. We've seen intergovernment departments collaborating. For example, in Botswana, we do have the security sector that have come together to form Botswana Main Sector to address issues around police and public health. We've also seen government and law enforcement also addressing issues of public health as it relates to multi-sectoral HIV, AIDS, TB, and STI response that is led by UNAIDS and other partners. Civil society also take a lead as it relates to addressing issues around human rights, key populations and violence, gender-based violence, issues around girls and women as it relates to their health and abortion. Regional bodies also play quite a critical role. The first one that we've seen in Southern Africa is the Southern Africa Regional Police Chiefs Coordination Organization called SAPCO. They collaborate in terms of health, HIV, and AIDS, STIs, TB, in terms of building and developing training programs for the region. Southern Africa Development Corporation also plays quite a major role as it relates to health. HIV, we've also seen them responding to issues around terrorism, insurgents, response in Mozambique. There are also regional organizations like ECOWAS, COMESA, ICAS, also responding to insurgents, for example, the Lord Resistance Army back in the day in Uganda, as well as also counterinsurgents in Sierra Leone. We've also seen some collaborations as it relates to Boko Haram, Nigeria, and El Shabaab in Somalia. The UN family is also doing quite a lot of work and leading some collaborations as it relates to peace building missions. We've seen in Sudan, Eritrea, Democratic Republic of Congo, Central Republic, for example, and also even policing around vulnerable groups. What have been the challenges and the problems? What we've seen is there are laws that have been maintained either from colonial times that criminalize, for example, same-sex relationships, sex work, and drug use. Civil society and community-based organizations, as I have mentioned earlier, have also faced some challenges as it relates to them being perceived or viewed as enemies of the states or promoting immoral behaviors or the Western agenda. There have been also issues around Global North or the donors when they do advocacy, especially as it relates to either same-sex, sex work or drug use, also receiving backlashes or seen as promoting immoral behaviors or the Western culture of doing things. Sometimes law enforcement, they are very rigid, bureaucratic, protocol-driven, and their processes are very lengthy, thereby having issues, especially when it comes to program, projects, lifespans, and so forth. There's also been lack of financial and human resources to maintain collaborations and partnerships. Sometimes incremental use of force as a complement to peaceful negotiations has also been challenged as sometimes the force becomes too much, or sometimes supports war zone or war characteristics. And there have been issues of law enforcement accountability to themselves and also to the security sector. We've also seen with the case studies that we've documented that they are quite these collaborations and developed partnerships also are they have an advantage to law enforcement. For example, improving the employees' strategies to respond appropriately to sexuality, drug use, gender-based violence, and so forth. I've also seen that in these trainings, they also include health issues around HIV, around violence, safer sex, preventing injuries, and so forth, as it relates also to occupational health. We've seen some improved skills to manage challenging situations. For example, when someone is resisting arrest and there is verbal abuse, when also responding to issues around overdose and withdrawals by people who use drugs. So in general, they've been increased knowledge, attitudes, and practices of law enforcement as it relates to these issues and so forth. There have been also very good examples that we've seen working well to build better collaboration. For example, in South Africa, as it relates to harm reduction, police in Durban have been advocating for drug users, which in most cases, this has been a shift in the dominant narrative. Mozambique as well, they've responded to gender-based violence and violence in particular as it relates to sex work, drug use, and LGBTI. And we've seen it work mostly in 11 provinces where the Mozambican police have installed, or they have a gender or violence desk where these key populations of vulnerable groups receive better service. In Kenya, we've also seen some documented cases that have been responding to stigma and discrimination, violence as it relates to police, especially by training sex workers and so forth. Liberia, Sierra Leone, we've also seen civil society organizations coming together with the security sector in responding to police, being sensitized on human rights of marginalized groups, especially sex workers or men who have sex with other men. Ghana, Nigeria, Uganda, and Zambia, there have been some civil society organizations or community-based organizations that have been working on educating police officers on human rights and raising awareness, especially when it comes to issues around girls and women, so that they can access services when they want to do abortion. As we have seen that the narrative before has been that it's criminalized, and mostly police are very brutal, and in the end, the girls and women do not have access to safe healthcare providers because they fear that if they go, they will be reporting themselves. South Africa, I've also seen a very good training program for police officers as it relates to human rights principles relating to drug use, violence, gender-based violence, and sexual orientation. Zimbabwe has also, been very instrumental, and especially Zimbabwe Republic Police, in addressing issues of COVID. Actually, we have seen police officers who are working in the medical field being deployed to general hospitals, and also, contributing, clinically to the service around, COVID-19. And so forth. And the last one is actually in addressing, issues around gender, rape, and disease as it relates to, areas around conflict and violence, especially in, Somalia, Sudan, Eritrea, Central Republic, Democratic Republic of Congo, and Mali, when police officers, especially over the past 20 years, have been involved in peace building missions, and also responding to issues around the rule of law and building a framework in those countries and so forth. So these have been some of the very good examples as it relates to collaborations in Africa. Thank you very much. This is what I had to share with all of you.
Good morning, good afternoon, good evening, everyone. Today I'm going to talk about envisaging the future of policing and public health globally by focusing on Asia-Pacific region. I would focus on 4 main issues. There are harm reduction, responses to COVID-19, gender-based violence, and mental health issues. With regard to harm reduction, many countries have implemented harm reduction programs like in Afghanistan, Bangladesh, Cambodia, China, Hong Kong, India, Indonesia, Laos, Malaysia, Myanmar, Nepal, Pakistan, Philippines, Taiwan, Thailand, and Vietnam. Most of the 4 programs were led by NGOs, civil society, in collaboration with government agency and public health sector. However, there are some legal issues and law enforcement dilemma. It's still a big challenge in respect of limited resources in some specific areas. There is one good practice in Vietnam called police-mediated legal and social assistance to drug users. They use the idea of a community-based program and have strong cooperation led by the police. For response to COVID-19, there are a variety of ways in response to COVID-19 in ASEAN countries. They use this technology-based response like a robot, mobile phone, and drone. And they use the idea of a community-based response like a volunteers. And they also implement media-based intervention to spread the public awareness regarding the COVID-19 infection. Like other places in the world, law enforcement agency has a collaboration with public health sector. However, it depends on resources. There is one good practice in Thailand. The village health volunteers in Thailand set up the programs like a home visit for those returning from risk areas. And they have a preliminary health check and report. They work closely with local police officers. They have the idea of local quarantine and home quarantine. Particularly at the moment, it has a big increase in the number of infected cases in Thailand. For gender-based violence, some countries have vigorously implemented programs in relation to gender-based violence, including India, Pakistan, Sri Lanka, Bangladesh, and Maldives. There are 2 categories of the program. One is the prevention-oriented, focusing on men offenders. And the other one is a victim assistance-oriented, focusing on providing help to victims, mostly led by NGOs and civil society. Again, there is limited resources in some specific area. There is one good practice that I'm going to show you. It's a Raptor police training program in Pakistan. It runs by NGOs. This program is a partnership between the Islamabad Capital Territory Police, National Police Bureau, the National Police Academy, Provincial Police Training Wings, and various police colleagues and schools. It aims to improve the relationship between the police and communities in Pakistan by providing training programs and to increase the self-awareness and life skills of police personnel It also is to improve their knowledge of gender issues and to enhance their capacity to deal effectively and sensitively with cases of violence against women and girls. The results has shown it increase in the police department understanding and awareness regarding gender issue. Many mental health related programs were implemented in ASEAN countries. Again, mostly carried out by government agency and healthcare sectors. And there are limited laws of law enforcement agency. I have one good practice in Korea, a psychological autopsy project for suicide in South Korea. It aimed to analyze the causes of suicide and prevent it since 2015 and create suicide preventive measures. They create Korea Psychological Autopsy Checklist 143. The police provide information on suicide victims. For this project, the police has close collaboration with the Ministry of Health and Welfare, Central Psychological Center conducting PA analysis of cases. The recommendation for the future, it needs to increase in the roles of law enforcement agency and more cooperation between law enforcement agency and healthcare agencies need to be done. In conclusion, law enforcement agency, local community as well as NGO or civil society need to have more collaboration to sustainably solve the target problems. Technology and media need to be implemented at national and local level in order to respond to COVID-19 and to raise public awareness. This is all my presentation. Thank you very much.
Hello, ladies and gentlemen. Welcome. I'm a regional researcher, Erkin Bek Idis Kulbekov. I'm a lawyer. Currently, I'm working as a vendor for the Soros Foundation. Within the framework of this program, we help key groups within society, including people with drug dependencies, people living with HIV infection, and sex workers, providing them with paralegal services so as to effectively protect and defend their rights in different spheres. The region that my work focuses on is Eastern Europe and Central Asia. Now I will deliver my presentation and will comment on the results of my research. Eastern Europe and Central Asia. The countries of Eastern Europe and Central Asia inherited their law enforcement and public health systems from the former Soviet Union. A study of the situation of the work of police with key groups and public health entities in the countries of Eastern Europe and Central Asia showed different approaches and methods of collaboration working together and in the way that different questions have been decided. In my words, previously everyone was at the same level between the countries in the region. However, a few countries were able to move further forward in terms of questions of collaborative work between the healthcare system, the police, and key groups compared with other countries. It is necessary to note that in a few countries in Eastern Europe and Central Asia, they've already changed the relationship with particular key groups and established certain programs. For example, a program on harm reduction. In these countries, legislation has been introduced that it has included some decriminalization of drug use. In other countries, the situation is unchanged. No country can simply copy, take international experiences and approaches or take findings from other contexts and suddenly apply them in your country. Now is not the time for that approach, but if we talk about the most basic elements introduced at the level of a country, that could be more than just a big political aspiration, but for that aspiration to be implemented, the approach needs to be based on concrete evidence. An example of this can be found in the countries of Eastern Europe and Central Asia, where they are very successful at introducing new programs, but where they're not always observers watching out for negative or side effects from these programs. In these countries, questions of healthcare are included in the strategic and regulatory documents of the law enforcement system. For example, the concept of narcopolitics, the fight against a socially significant disease. The law enforcement system participates in the development of strategic documents in collaboration with the healthcare system. For example, the development of a national program on HIV. Municipalities coordinate issues related to healthcare and law enforcement actions. Successful programs in Kyrgyzstan. The program Syringe Exchange. The program was first introduced in 1999. In the present day, the program encompasses the majority of the region. The Syringe Exchange program allows users of injectable narcotics to be supplied with sterile injection equipment with the aim of stopping and decreasing the spread of HIV infections and viral hepatitis. The Syringe Exchange program is operated out of drug addiction treatment centers. There are successful practices that can be learned from the implementation of this program within the penitentiary system in Kyrgyzstan. The next program is the methadone substitution support therapy. This program was introduced in Kyrgyzstan, Kazakhstan, and Ukraine. The aim of the program is the complete negation or the lessening of the drug user's demand for illegal opioids, decreasing the harm and health risks from methods of introduction of substances into the body. As we know, drug users share one needle between multiple users, and that risks the spread of socially harmful illnesses. This particular program in Kyrgyzstan was first introduced in 2002 as part of a pilot project. The project started in the city of Bishkek. However, in the present day, the program continues to grow and the site methadone treatment sites have spread to other oblasts, which is to say that the project is expanding. Kazakhstan, with the support of the United Nations Office on Drugs and Crime from 2015 to 2019, was established a system for police to refer drug users to 3 demonstration sites. This particular project was implemented in Kazakhstan. Trainings were held with the aim of increasing the capability of the police and social groups, as well as roundtable discussions that brought together project participants and stakeholders from different parts of the project. Between different police departments and non-governmental groups, a memorandum of collaboration was signed to establish the new system of police referrals. In Moldova, initiatives with the aim of increasing the capacity of police for working with key groups, redirecting how drug users, sex workers, and other key groups are connected with social services. This program will continue until the year 2022. This is the end of my short presentation. Thank you for your attention, and see you soon.
Good afternoon. So I would like to welcome you to this presentation of Envisaging the Future of the Global Law Enforcement and Public Health Association. Before anything else, I would like to introduce myself. My name is Jaime Redondo Sanchez Lira. I am a professor of the Center of Research and Economic Learning. And I would also like to introduce Sergio Molin, who was international consultant, the former director of the National Argentinian Ministry of Health. So today we're going to talk about global health in Latin America. As we know, this region is the most violent region in the world. Homicides and crime have a negative impact on economic development in our region. And we know that these problems of public safety are ranked as #1 in the opinion polls within our society. So this, unfortunately, has make the authorities to mentalize more the public safety and also to use the penal system as a way to try to reduce crime. And that's why we have a great incarcerated population in our societies. So we can classify these projects in 3 broad groups. The first one is policing response. So police strategies directed to deal with these issues. We have some alternative non-police response. And the third are these collaborations between police and civil society. So regarding the first group, we can talk about the strategies that are centered around traditional policing responses, such as community policing programs, quadrant deployment, and the use of information technologies to identify hotspots, etc. And the idea of these projects is to try to integrate policing with the local population's needs. We have some examples in Brazil, which is the clearest one. We have the pacifying police units in Rio de Janeiro, or the police operation management units in Bahia, Salvador, and Bahia as well, the community security bases. So the idea is to integrate social services once the police takes over these spaces to try to the state to go back and to provide security and other social services to the community in these environments. We also have other responses that are more related to an alternate strategy. And here we can talk about strategies like harm reduction, youth violence prevention, or social cohesion. Here we have 2 examples of Mexico. One is a more recent one in Iztapalapa about the colibri concept, which the colibri centers, which basically is a new model for substance use attention aims to shift the understanding of substance use from a criminal problem into a public health issue, and works directly with people. We've had 10 centers open so far, and we have cared for 70 patients. And unfortunately, their operation was reduced due to COVID. Another one is an occupational safety and harm reduction training program called Escudo in Tijuana that would focus on improving the occupational health through the train the trainers model so that they could apply the knowledge in the officers of the corporation. So this is based on empirical evidence of other models in the US and Asia, and it was funded by NIDA. And the third are these collaborations of the civil society with the police. Here we have a great example, which is Red Sex, which is an initiative of female sex workers that offers police trainings that are geared to decrease the stigma, discrimination, and institutional violence to which they are exposed on a daily basis while doing their work. So I would like to talk a bit more about this Red Sex case, because it's an interesting model that would help us to understand how we can advance to a sustainable model. So Red Sex originally started in Honduras, but now it's working in more than 10 countries. And it's a model that is bottom up. So basically, the female sex workers have led the design, execution, and presentation of the outcomes of the sensitization programs for first-hand advocacy to decrease the stigma, discrimination, and institutional violence. It's a collaborative work between sex workers and police officers, and the advantage is the publication of results, and also for reports and best practices manuals for replication. In Honduras, we have more than 4,000 members of the security forces that have been trained by this model, and this has also been provided to other institutions in other countries. So what do we see in Latin America? We see that there is no clear direction about who drives these projects. But for example, in this case of Red Trust 6 that has lasted for more than 10 years, we have the international donors and peers that have been fundamental for the success of this project, and so they could be sustainable in the long term. So it's through the empowering of these peers. We have the sex workers, the German embassy, we have the UN AIDS, and also the collaboration, the local collaboration of the Honduran police. So this is a model that shows a unique ability to replicate in many other countries that still don't have this. So what are some of the challenges that we have found, unfortunately, in our region? So unfortunately, some initiatives are like, they have been canceled. They're very fleeting due to government changes. So they seem to have a great future, but they are canceled when the government changes. So a typical example of this can be the Open Arms Project in Brazil or CAMADS in Colombia. So generally, also what can influence our region is the fact that corruption that permeates many of our policing agencies in our countries, this modifies citizens and police officers' interactions, and it can affect the initiative's results. Like, for example, proximity policing, which we have in Neza, Mexico. Another phenomenon that we cannot ignore are the high levels of violence and organized crime, involvement and penetration in security forces. And we have seen this in some tragic events in Mexico. And as I mentioned at the beginning of the presentation, there seems to be a growing trend toward militarization of the security forces, the public security forces. So in this context, some of the challenges that we would have to look into would be, firstly, how can we work so that the communities can approach the police forces without fear of stigma? The second point is that there are not enough public resources focused on non-police alternatives. Usually we think that to improve the police, what we need to do is to get more policing. But unfortunately, many times we depend on international funding. And this makes it difficult to work at the local level. And the other thing is lack of evaluations and systematization of programs that are deployed. It looks like we don't learn anything, and then after every government changes, we start again from scratch. So with that, I would like to thank you for this brief moment. If you have any questions or if you have any programs that you would want us to include in our assessment of Latin America, please write us to our email address. And that's all I had to say for now. Thank you very much.
Hi, I'm Dr. Michelle McManus. I'm the Head of Criminal Justice at Liverpool John Moores University. And today I'm just going to be giving an outline of the Western Europe research that I've been involved with for the project Envisaging the Future of Policing and Public Health globally. So a couple of things just to start on. So some of the considerations when doing this desktop research and what we were looking for was in terms of evidence, particularly around evaluation of different initiatives across Western Europe, and particularly those that had something slightly different, were innovative in what it was they were trying to achieve. And this could range from small scale projects to very large projects, which you'll see in some of the case studies. And one of the key things obviously is around accessibility of what information was available, which sometimes required some one-to-one contact with key people that were involved in the initiatives, and with a consideration of COVID-19 going forward. So some of the key things that we found across Western Europe that are working particularly well, and some of the aspects in terms of the types of research and types of initiatives that we were finding were around violence prevention, particularly around child exploitation and violence against women and girls, and I'll go into some detail around this in a minute. Trauma-informed practices and approaches, particularly across Europe, this is something that is really been developing over the last few years, following on from some of the work that's obviously been done over in Canada and America. A real emphasis, particularly in the UK, around multi-agency and partnership work, and then also kind of furthering that into very specific models around mental health and domestic violence co-responses. There's been a lot of development, particularly I think this is going to continue post-COVID from what we've seen around substance and alcohol misuse, and linked with workforce wellbeing and community recovery, which I'll be touching on. So some of the things that we've kind of uncovered in some of the research that we've done so far is around a kind of really clear awareness, which is great to see, of leaders and practitioners with this kind of mantra of we cannot arrest our way out of this. And that has probably been helped, particularly in the UK, around this buy-in from cross-government ministers and leaders have really echoed these statements that have allowed other people to then continue with this going forward in terms of that frontline approach out there with the communities. One of the big things that we've seen is this try to co-produce a lot of the work along with not just those users and those vulnerable populations, but also in terms of those multi-agency practitioners and understanding how things can be operationalized on the ground. And other things that are working particularly well is around sort of change of language, which is helping to change the culture and traditional responses in terms of silo working. However, there still is an acknowledgement of a need for evidence-based and evaluation from the start. There is certainly a lot of evidence from the stuff that we've discovered so far in the project is around a lot of the evaluation activities may start a few months after the project or are called in near the end of the project, when data may not be as freely available, and actually trying to gather what impact or contribution the initiative has had becomes much more difficult. And as I've said before, around this kind of co-production in terms of the design of initiatives that are working well, but also in terms of that user voice right at the beginning of some of this work in terms of the design and creation of some of these initiatives. So some of the problems and challenges that we've certainly found is around this idea of unrealistic short-term data indicators and measures. A real frustration, I suppose, particularly in the UK, is around this kind of government-led funding that often require us to submit evaluation bids with a few weeks' notice to start the next month, with only around 4 to 6 months to be able to complete the project. This is problematic, not just in terms of evaluation, but a lot of the big projects, even across the UK, that we've seen, and I'll touch on the violence reduction units in a moment, have only often been refunded on an annual basis, with people obviously wondering if and how they're going to sustain some of the activity they've got. So really trying to establish some of the more softer and longer term impacts is becoming much more difficult within these projects. Linked to this is around some of the targeted funding, where we tend to hit those kind of very high profile problem areas first. And I think there is much more conversation about the displacement of some of this activity and the different types of problems and vulnerabilities that other areas may not have, that sort of big city areas might be experiencing, and not really understanding some of the vulnerabilities that can build up in those smaller or rural areas. One of the criticisms we've seen, and certainly I think this is the case across Western Europe, in terms of the removal of universal services and funding cuts across some of the key sectors within this, whether that's schools, early family healthcare, community support and safe spaces, which obviously have been worsened by COVID. And then this idea of a commitment and language and culture change, which we really need to see into action. There's a lot of words being said across our leaders, but actually there's certainly a repetition of some of these findings in terms of government changes that are needed, as I said, the universal services funding that are needed going forward. So just a very quick look at some of the case studies that we've found so far. I've purposely put some links, which hopefully you'll be able to see on the slides, to go and look in a bit more detail around this. So one of the kind of key projects that's kind of come out in the UK is the violence prevention work that's been done. So the serious violence strategy that was introduced in 2018 had a massive uplift of funding from government. And as you can see, 35 million was given across 18 of the 43 police forces in the UK to establish these violence reduction units. And this came from a very successful model within Scotland, which I recommend if you've not read about and follow, then you do that. What was key about this approach is using the Hughes definition of a public health approach in addressing these risk factors in becoming a victim or perpetrator of violence. And with this emphasis, it really required the VRUs to produce some of these 2 mandatory products to really ensure that they've got this evidence base going forward. One being the problem profile or a strategic needs assessment, and also a response strategy, which really included, as I said before, that multi-agency response. However, one of the issues that we found when we've been digging into some of the work that's been done by the VRUs is there's still a problem with the language of a public health approach, with a lot of practitioners preferring a whole systems approach. So again, might be starting to sort of establish or identify some issues around language and understanding around what it is these initiatives and these projects are trying to achieve. And just to highlight really one particularly successful violence reduction unit who stand out a little bit in terms of the research that we've done, in terms of them looking at violence exploitation and a reduction unit they call themselves. The 18 violence reduction units all have a slight different approach on what they include under violence, whereas the Bedfordshire model certainly is explicit in their inclusion of exploitation within that. They all have some great information on their websites in terms of how they're approaching violence using the public health approach, and certainly worth looking at. And just to further emphasise how the different violence reduction units are being focused, there's 2 further infographics here showing that Wales Violence Reduction Prevention Unit, is very much focused and very leading the way in terms of their evaluation evidence. Lots of reports on their website, and in particular, again, the Merseyside Violence Reduction Partnership, who seem to have a real strength in terms of ensuring that life-course public health approach, and work closely with a public health institute in a lot of their research and evaluation work going forward. So just to kind of summarise some of the work there, there is certainly some highlights and benefits of the government funding in that uplift, and ensuring some of the evidence base is there from the starting blocks in terms of ensuring the strategic needs assessment, and the theory of change models are certainly in place. However, there is still this worry about the targets in the short term funding and sustainability going forward, and some of the requirements in terms of indicators. Are they actually fully capturing the impact or the contribution of some of these initiatives? There's obviously questions about the other 25 police forces and how they are engaging in violence reduction in their areas without this particular uplifting funding. And then also around how they work, particularly in the UK. We've already established partnership models within the UK. We have a tripartite requirement in terms of police, health and local authority owning the safeguarding partnerships across areas. And the issue that we have is there already are a number of safeguarding policies and practices that do exist. And then adding a VRU on top of that, the violence reduction units, how do they all actually work collectively together is still needing to be understood. There is also still issues around sustainability of staff, particularly post-COVID, and how we're going to sustain that going forward, particularly as we've got a lot of sickness records and the pinging issue that we have certainly within the UK now, and how we can ensure in terms of that universal support services, our continued funding radar for government, for local safeguarding partnerships going forward. And just very quickly, another project, I've put the link on the website for you there, is STAD in Europe. Again, a real focus on how the community can be involved in helping to reduce some of the violence prevention, binge drinking, particularly in the nighttime economy around this. Again, there are some great infographics and some great leaflets that you can get from the website, which show some of the results that they've achieved across Europe in terms of decreasing violent crimes, and how they've done that through a number of different initiatives and some of the cost savings around that as well. And just lastly, there's a lot of focus on these kind of co-responder models at the moment. Some street triage teams that are looking to identify and understand and respond appropriately to some of the needs that are happening within our communities as well. So in terms of just summarising, in terms of key considerations going forward, one of the key things that we need to think about, again, post-COVID, is how we recover our communities and that universal support that seems to be lacking post-COVID. There is a lot of data that's coming out around the very poor mental health statistics globally at the moment, not just across Western Europe, and the demand that we have for services and the waiting times already before COVID, and how we're going to be able to meet that demand going forward. And also considerations of the workforce. There's certainly a lot more attention being brought to the exhaustion of a lot of our frontline emergency services. And just lastly, on the point of early intervention and prevention, and how we can ensure those voluntary agencies that we're in our communities building our building blocks for prevention of violence and knowing our communities. How do we rebuild them from professionals in our communities, but also the confidence of children to then use them again. There are definitely opportunities for growth. I will try and end on a positive. And one of the key things is around how there definitely is an agreement around multi-agency working. The infographic says it all, many hands make light work, and how we do need a whole systems approach, which seems to be the agreement across Western Europe in terms of vulnerability responses. And the importance of evidence and evaluation, and trying to go a bit more upstream in terms of getting in at the right place and starting to build some of the indicators and some of the systems and understanding what can be collected and what can be measured before programs and initiatives go live. But there is certainly a wider acceptance of longer term work before, we realise the goals that we're trying to achieve, and that actually it might be beyond the lifetime of some of us that those goals would be achieved, and a bit more awareness around that. Advances in terms of systems and data sharing. GraphNet, if you've not come across it before, it's worth a look as to how they're starting to advance some of the data sharing across health and social care. And also just this idea of listening to our young people and finding more innovative ways to connect with our youth, particularly as a digital age has certainly increased in COVID amongst all of our population, but particularly within COVID. And this final point of reduction in overlapping strategies and policies, and this kind of need for just refunding hot topic areas without really seeing what's going on underneath them. So for example, county lines is a particularly UK hot topic, but actually some of the vulnerability that sits behind county lines, the local drug running and some of the deprivation that exists, school exclusions need to be tackled as well. It's not just the hot topic of county lines. And that's it from me. If you've got any questions, my contact details are there. Thank you very much for listening.